Good afternoon. I am Tom Hudako from the Utah Department of Health, and welcome to today's COVID-19 media briefing. We have one speaker today. That will be Dr. Angela Dunn, who will be providing a situational update. Dr. Dunn?
Okay, good afternoon. Today we have 4,828 cases of COVID-19 in Utah. That is an increase of 156 from yesterday, or a 3.2% growth rate. We've tested over 112,000 Utahns for COVID-19. That's an increase of 4,057, and we still maintain a 4.2% positive rate overall. And we have no new deaths to report today. We've talked a lot this week about how it's really important that we protect high-risk populations and do what we can to ensure their safety. And part of that is the Department of Health and our unified command setting up strike teams and mobile testing units. And today we've deployed our first strike team to a facility, a residential facility in Utah County that cares for adults with intellectual disabilities. Several staff and residents have tested positive for COVID-19 over the past several days. So the strike team is providing nursing level care, PPE, medical supplies, and also testing for all those residents and staff who initially tested negative. We're approaching this with a sense of urgency and working very closely with the local health department and the facility to minimize spread of COVID-19 in this facility. Right, with that, I'll take some questions.
You're on.
Dr. Dunn, this is Michael Orton with the Capitol News Service. Good day to you, and thank you for all of your good efforts. Can you give us, since the state has been so capable regarding the response to the COVID crisis, can you give us some idea of where things are at in terms of antibody testing, either intramurally here in the state or nationally or even internationally, and how that may be affecting? And secondly, from your vantage, what is the most encouraging aspect of what you've been witnessing over the course of this situation?
Sure. So with regards to antibody testing, we know our local lab here, ARUP, is offering antibody testing. So somebody can get that with an order with their physician. We at the health department are working through our processes of how we're going to respond to positive antibodies. We do know that there's a lot of uncertainty around what a positive antibody test means with COVID-19. There are some reports of reinfection with COVID-19, so it's unclear whether or not someone develops immunity, and if they do, how long it will last. So there is a lot of caution to be had when interpreting antibody results. In terms of kind of encouraging things we've seen in Utah, I think the combination of our high testing capacity, so the ability to be able to test anybody that needs COVID-19 testing, is a really strong piece of our response here, in addition to our contact tracing efforts. So we're still prioritizing contact tracing for all confirmed cases and expanding that to include testing of targeted asymptomatic people. These approaches will certainly help us continue to plateau and eventually drop our cases here in Utah to continue to control the pandemic.
Any aspect or any advance on asymptomatic spread or any analysis of that?
Sure. So not specifically for Utah, we just have small numbers to be able to draw any conclusions from that. But we do know from national and international studies that pre-symptomatic spread, so somebody who eventually goes on to develop symptoms due to COVID-19, there is evidence that they're able to spread COVID-19 prior to developing symptoms. So that is the exact reason for social distancing and wearing masks when social distancing is not possible.
And lastly, do you have any other additional numbers on the adoption of the application of Healthy Together?
Sure, I don't have any updated numbers from yesterday.
Thank you, and Dr. Dunn, this is Chris Reed, St. George News, and once again, thank you. As far as areas of the state, like southern Utah, they haven't necessarily been as affected numbers-wise as certainly Salt Lake County and Summit County has. As we've moved into orange now, and people are starting to go out a little bit more, even gather in groups of 20 or less, hopefully, what is one piece of advice you would give to those who haven't necessarily seen the effects that may have been seen in northern Utah?
Sure. I mean, the key to preventing additional spread throughout the state of Utah is going to be staying home if you do have symptoms or you've come into close contact with someone who has COVID-19. That's really going to prevent spread to additional individuals. So even though we are opening pieces of our economy and society, those principles still hold. And then especially for our more vulnerable populations, older adults, those with underlying medical conditions, it's important for them to maintain social distance even if they aren't ill.
Thank you.
Dr. Dunn, Ben Winslow with Fox 13. What are you anticipating as far as a resurgence possibly later this year in cases? Are you expecting it to be worse than what we've experienced now? Do you have any kind of modeling or trajectory for that?
Sure. Again, there's a lot of models out there, and they certainly help us help inform our response, but none are perfect in predicting what's going to happen, especially with a novel pandemic. However, we are anticipating a second surge in cases to coincide with flu season, given that they're both respiratory viruses and spread in the same way. And so we're preparing for that as a state with our healthcare providers and our local health departments. I think the challenging piece is going to be that element of social distancing. Will we need additional social distancing restrictions come fall when or if we see a second peak? And that's going to be something kind of we as a state and society have to try to figure out of kind of what's the tolerable level of doing social distancing again in the fall if we do see another peak.
Hi, Dr. Dunn. Thank you so much for everything that you've been doing. I have a couple questions about Test Utah. And they've said that they're working directly with the Department of Health. So I'm wondering if the Department of Health is monitoring how they're conducting their test. And if you would be able to, shed some light on any of that.
Sure. So we've definitely been working with Test Utah from the beginning, providing them our statewide guidance in terms of who to test and how to test. Recently, we definitely have strengthened that partnership and have kind of more of a direct collaboration in terms of making sure that it's consistent across our state so that any Utahn can show up at any specimen collection site and receive the same experience. So that's improving over time, and we expect that it'll continue to do so.
But are you looking at who is actually administering the tests? Is there any health official that is watching or monitoring these tests in these, 7 different sites?
Sure. So we haven't had that level of, observation or regulation over the Test Utah sites. But certainly our local health departments where they're at work with them directly in terms of understanding how they're developing or how they're going about collecting the specimens. So again, that's something kind of as we move forward, we hope to strengthen that effort of collaboration so that we have a greater understanding of exactly how things are going.
Since there might not be oversight, could the test be flawed?
Sure. So, I mean, there's a lot of reasons why test for COVID-19 could be flawed. How you collect the specimen is one of them. So we're working with all of our specimen collection sites to ensure that we can have confidence in the results we're seeing. And so that is a standard practice across all of our specimen collection sites, including Test Utah moving forward.
And my last question involving Test Utah is that its website says that data will be collected and retained for the short term to aid the state, and it will keep that data until the pandemic is deemed over. How long do you anticipate the pandemic being in place?
That's a good question. I mean, we of course can't predict anything, but with a second wave potentially coming in the fall, we anticipate this pandemic being on the top of our minds and a priority, especially until we get a vaccine. So we're looking at least another year.
So Test Utah could have our data for another year if we signed up for their assessments.
Sure, and that data is helping public health in terms of identifying risk factors for people who have symptoms and test positive, and so that we can better identify kind of those risk factors associated with COVID-19 and allocate resources appropriately.
I appreciate it, Dr. Dunn. Thank you.
Hi, Dr. Dunn. It's Ashley Imlay with the Deseret News. Where are we at in being able to get current hospitalization numbers?
Did you say current hospitalization numbers?
Yes, sorry.
Sure. So I'm hoping to have those for you next week. We're working with all of our hospitals right now to make sure that they're collecting data the same way. There has been some inconsistencies, so we want to make sure that the numbers we give to the public are a true representation of COVID-19 hospitalizations that are currently happening. So hopefully by next week.
Thank you.
Hi, this is Lee Davidson with the Tribune. Could you provide any more details at all about the strike team and what sort of facility they're helping? Is it
Sure.
a living center of some sort, or what
So
more
it's-
can you tell us?
Sure. It's a residential facility in Utah County that serves intellectually disabled adults. They don't typically have nursing level care there. It is more of a intermediate care facility, and so because of this spread of disease within the facility, our strike team is providing that level of nursing care in addition to medical supplies that they don't routinely stock there, including PPE, to be able to care for the ill residents in that facility, and then also prevent further spread.
Can you say roughly how many people have tested positive there? Or?
Sure. So 15 of the 40 residents have tested positive and 9 staff have tested positive.
And I'm not familiar with the strike teams. Can you tell me what sorts of professionals you have in there working? Sure. How big a team it is?
Yeah, so they're definitely going to be tailored to the needs of a situation, but they have the ability to have medical care teams, investigators to identify exposures, and then of course testing capacity to be able to test any of the residents or staff for COVID-19.
Okay, thank you.
Okay, this concludes our briefing. Thank you so much.
Thank you.